Okay, so let's solve 100 MCQs, and I'm gonna start it on my app on my iPad over here. I'll just set up first. I'm just setting it up, and I will start the stream. Today's like my first ever stream, so it's gonna be a little slow. It's getting the hang of it. So the first set of 50 which I'm doing are all my bookmark MCQs. And the second set of 50 are the random MCQs. So it's going to be like that. Yeah. So this is my. So let's start with the stream. So right now I'm like doing 50 and I'm doing the bookmark ones. If anyone wants, the custom module code is 55Q7036D, and I'm using Marrow for doing this. All the writes and everything is going to Marrow. They are not my questions, they are their questions which I'm solving online. So the first thing is 35-year-old housewife presents with facial weakness on the right side, difficulty in closing the right eye, and loss of taste sensation. A diagnosis of Bell's palsy is made. Which of the following is false regarding this condition? So they are asking what is the Bell's palsy ka false statements. So herpes virus is a cause. It is idiopathic. Males are more commonly affected than females, and recurrence is uncommon. So, galat, what is the wrong statement? The wrong statement is it affects both males and females equally. It is an acute onset, idiopathic, ipsilateral element facial nerve palsy. So, yes, it is caused by herpes simplex, herpes zoster, Epstein Barr. All of these viruses cause it. Yes, it is idiopathic also, and the recurrence is uncommon. So normally, once you get it and you recover for it, it's going to be like 3 to 10% cases only get it again. It's not going to happen again and again. So um, that is this question. Interesting question because we don't know. We always assume that males are going to be more affected than females, but it's both. Then our next question is going to be a 21-year-old patient 21-year-old boy comes to the clinic in summer with red plaques over axilla and inguinal folds. A biopsy of the skin lesions revealed a dilapidated brick wall appearance. What is the most likely reason for this? So we know, okay, this is going to be because of Haley disease. So, usme what is happening? It is a sort of a that bullous disease only. So, fluid accumulation between keratinocyte, increased number of keratinocyte, condensation, and loss of cohesion. So, it is loss of cohesion only. It is a sort of a autosomal dominant disease, and it is going to be because of breakdown of intracellular bridges. So you're going to see it in the flexure region mostly, and they're going to secondary infection भी हो सकता है उसमें with Staph aureus or herpes or Candida. Skin biopsy करके we can come to know, and it is basically acantholysis only which is happening. So that's what I'm saying, right? It's a bullous disease, acantholytic disease, and mild dyskeratosis may be seen. ठीक है. Next is this. It is an image of that diphtheria child. So, 6-year-old child presented with sore throat, fever, and malaise. Examination findings are given in the image below, which she also found to have penicillin drug allergy. What which antibiotics can be used in this patient. तो दे आर सेइंग कि उसको पेनिसिलिन ड्रग एलर्जी है और उसको डिप्थेरिया हुआ है. तो व्हाट कैन यू यूज? द ऑप्शंस आर जेंटामाइसिन, सेफिरोक्सैम, एरिथ्रोमाइसिन एंड डॉक्सीसाइक्लिन. तो क्या यूज कर सकते हो आप? So the answer is erythromycin. Okay, so erythromycin can be used in penicillin allergy, and you can remember कि this antitoxin therapy is also very important. You have to give 20,000 to like 100,000, which is 1 lakh units of you have to give antitoxin. Normally, penicillin G or benzyl penicillin is a drug of choice, but अगर एलर्जी हुआ तो एरिथ्रोमाइसिन यूज कर सकते हैं. Others which you can use is ठीक है. Just remember one एरिथ्रोमाइसिन यूज कर सकते हैं हम लोग. And yeah, apart from that तो we just do the anti household contacts के लिए क्या करना है? So household contacts we have to monitor for 7 days and you have to take culture. Antibiotic prophylaxis you have to give even if they are immunized. If they are immunized and if fewer than 3 doses have been given or उनका history पता नहीं है, then you have to give toxoid as well. If it has been more than 5 years since they have taken everything, they have to give a booster. And if it has been less than 5 years, then no boosters required. So three things: antibiotics सबको देना है. अगर पूरा उन लोग ने कोर्स कंप्लीट ही नहीं किया है या तो उनका कोर्स का हिस्ट्री ही पता ही नहीं है, then you have to give them the immediate dose of toxoid, and then you have to give the whole thing. Okay, you have to also give them the whole vaccination. अगर उन्होंने लेस देन 5 years के अंदर अंदर ही इम्यूनाइजेशन किया है, then you have to do nothing. But if it has been more than 5 years, then you have to give them a booster. A 1 month old infant diagnosed with primary adrenal insufficiency presented with failure to thrive, recurrent emesis, and hepatosplenomegaly. We are going to see bilateral adrenal calcification radiographically. What enzyme is this? So, this we know it is because of metachromatic dystrophy, metachromatic or something like that now, leukodystrophy. So, that is, so they're asking which of the following enzymes is deficient in this condition? 11 beta hydroxylase, acid lipase is the answer. Okay, it is because of Wolfman's disease. Sorry, I was wrong. It is not hepatochromatic dystrophy. It is Wolfman disease. Wolfman disease is because of lysosyl acid lipase. Or when that is deficient, it is going to lead to accumulation of cholesterol, esters, and triglycerides in most of the organs, and you're going to get hepatosplenomegaly, hyperlipidemia, bilateral calcification of the adrenal gland, all of that. So that is Wolfman acid lipase. Next is what is the diagnosis from the X-ray, which is given below. So they are showing you an X-ray which has a very typical penicillin cup appearance. So this penicillin cup is seen in psoriatic arthritis, and you're also going to get periarticular erosions and everything. So you're going to get penicillin cup, this something like this. So this is penicillin cup appearance. And the other deformities, so we know only PIP, DIP, MCP, or everything it is going to be affecting. In a patient with uncontrolled diabetes, what is the value of plasma clearance of glucose? 0, equal to inulin clearance greater than PA and PAH and greater than 0. So they are asking what is the plasma clearance? Hmm. It is going to be greater than 0. In uncontrolled diabetes, the plasma clearance is greater than 0. Normally, all the glucose is filtered, which is filtered is reabsorbed, and no glucose is excreted, and hence the clearance is normally 0. But in uncontrolled diabetes, because the plasma concentration is greater than the threshold, that is why it is greater than 0. A farmer was presented with suppurative wound on his arm and respiratory symptoms. Later, he was diagnosed with melioidosis. The causative organism of this disease belongs to which category of bioterrorism agents as classified as CDC. So they're asking melioidosis is which category? A, B, C, D. It is not C. It's not D. So it is either A or B. Uh, It is B. Okay, Burkholderia pseudomallei belongs to category B. It is also called as white mouse disease, and you are going to get a suppurative wound infection that occurs at the site of inoculation, presents with fever, upper lobe consolidation, gram-negative organism dikhega. So it is B. Next is a test is done to check the immediate sign of death where fingers fail to show congestion distal to the ligature. What is the name of this test? Is it it is the name of the test is Magnus, Diaphanous, ICAR or Winslow. So these are the options. The answer is it's a Magnus test, also called as a ligature test. So this is done to see the cessation of circulation after death. So बहुत सारे other भी दूसरे भी टेस्ट है after death जो normally we don't study about. One is Magnus test जो हम लोग ने बोला. So what we do is take the like a finger and we tie a ligature and then we see if the blood circulation is it filling up or no. If it becomes like if the congestion is not there, they still do it. That means that the person is dead. So that is Magnus test. Second is diaphanous test, which is trans illumination test. So what you're doing is you're taking the finger and you're going to show like a light from here. So either say redness दिखना चाहिए in the web spaces. Okay, that is not seen, then that is diaphanous. What is ICAR test? ICAR मतलब you are putting a fluorescent dye and seeing if कुछ discoloration हो रहा है कि नहीं. So I can discolor. So I can dye. You could just remember I card is I can dye. So I can मतलब I'm putting the dye. So I can dye. Fingernail test is basically you're seeing the blanching and filling of fingernail on application of pressure and release. So that is the fingernail test is obvious. I card अभी समझ में आ गया. Diaphanous is illuminous, so you're illuminating, and Magnus is a ligature test. Winslow test भी है option में. That is basically now movement of the surface of water in a bowl kept on the chest. So Winslow versus water. So that is the all the options are cleared. Now a male patient, a male infant with a history of not passing meconium, presented with um, abdominal distension 2 days after birth. Bearing edema showed marked colonic dilation above the narrow segment in the sigmoid region. A biopsy was done and you got absence of ganglion cells. So what is it associated with? It's associated with Downs. So this is basically Hirschsprung disease and Hirschsprung is associated with Downs. अगर वो लोग पूछ भी रहे हैं कि what is other like Edwards is related to malrotation Meckel's, Patau is related to omphalocele, incomplete rotation of colon Meckel's diverticulum. A 34-year-old male patient was diagnosed with HIV with complaints of 4 weeks of diarrhea, abdominal pain, and weight loss. CMV colitis is suspected. What is the diagnostic investigation of choice? Serum CMV, IgG, colonoscopy with biopsy, serum CMV, polymerase chain PCR, and urine CMV PCR. तो क्या करना है इसमें? सीरम करना है, कोलोनोस्कोपी करना है, सीएमवी का पीसीआर करना है और यूरिन का पीसीआर करना है. So normally we'll think the answer is urine. So that's what even I did. I thought the answer was urine CMV, but it is not urine CMV PCR. It is actually colonoscopy and biopsy. So initial evaluation of a patient with HIV and diarrhea includes a set of stool examination like culture, examination of ova, parasite, and C. diff toxin. But if all of them are negative, then you have to do biopsy, upper or lower endoscopy with biopsy, which gives a yield of diagnosis of microsporidial or mycobacterial infection. So just because ये है HIV के लिए, we are suspecting CMV colitis, but we have to do a colonoscopy with biopsy. We can't directly do serum of for an HIV patient. Next is 17-year-old student develops infectious mononucleosis. After 15 days, he develops high fever and his sore throat worsens. He has lost ability to swallow and severe neck and chest pain. Upon admission, he has signs of sepsis and respiratory distress. What is the organism most likely to be involved in this condition? Mm, the options are Prevotella, Bacteroides Peptococcus niger, and Fusobacterium necrophorum. So the answer is going to be Fusobacterium necrophorum, and the clinical features of Lemierre's disease is this. Basically, this is called as Lemierre's disease, and Fusobacterium necrophorum uh, is most likely the is most likely to be involved in this condition. Fusobacterium necrophorum is a gram-negative anaerobic bacillus that is pleomorphic. It is involved in very severe oropharyngeal infections that can progress to complicated life-threatening conditions called as Lemierre's disease. It is most commonly caused by Fusobacterium necrophorum. However, species of Bacteroides echinella and all also may be implicated. Lemierre's disease is occurs after infectious mononucleosis in older children and young adults. इसमें internal jugular vein septic thrombophlebitis can happen. This progresses to abscess of the lungs, mediastinum, pleural space, and liver with sepsis. It presents with pharyngitis that is not resolving, associated with rigor, neck pain, and swelling. So basically, they are saying is एक बंदे को infectious mononucleosis हुआ था 15 दिन के बाद. He had very high fever, बहुत sore throat खराब हो गया. He could not swallow, had neck pain, chest pain, sepsis, respiratory distress. इतना सब severe conditions में चला गया after infectious mononucleosis. So this is Lemierre's disease, or Lemierre's disease is because of Fusobacterium necrophorum, and that is the most common. Okay, it is a gram negative anaerobic bacilli, and other also can cause like bacteroides. जो भी options में दिए वो लोग भी cause कर सकते हैं, but the most common cause of Lemierre's disease is Fusobacterium necrophorum. Next, what is a Lancefield grouping of beta hemolytic streptococci based on? T antigen, M protein, group specific C carbohydrate antigen, and group specific cell wall polypeptide. So that we know कि Lancefield grouping is based on groups specific C carbohydrate antigen, और जो M है वो Griffith protein है. So M protein के ऊपर basically on protein antigens is Griffith typing. Now, 16-year-old girl has intense craving for food. She eats large amount of food, which is followed by self-induced vomiting. BMI उसका 22 है. What is the first line treatment of her condition? Cyproheptadine, fluoxetine, buspirone, and mirtazapine. So I think the answer is fluoxetine. So answer is SSRI. So basically, just remember one thing. अगर bulimia है, okay, a lot of person who have bulimia, if you have seen Pretty Little Liars, उसपे there was this one actor जिसको bulimia था on the show. So remember, bulimia is associated with a lot of anxiety. You have to give anti-anxiety medication. So उसमें most commonly it is SSRI. First line to CBD करोगे, that is cognitive behavioral therapy. That's the first line of fluoxetine. उसको first drug, first pharmacological treatment. Then if it is, let's say, uh, let's say in this thing is there, anorexia. ओके, एनोरेक्सिया जहाँ पे वो कोई खाता ही नहीं, उनको बहुत ज़्यादा डिप्रेशन है, सो फर्स्ट लाइन इज एंटी डिप्रेसेंट्स फार्माकोलॉजिकली. Next, which of the following is an unpaired vessel in the CNS? Basilar artery, vertebral, anterior spinal, and both A and C. So, vertebral artery तो नहीं है answer because we know कि it is two. Basilar artery is single and anterior spinal artery is also single. So the answer is both A and C. Anterior spinal artery, see the diagram, you'll understand. This is anterior spinal artery जो एक है और एक है बेसिलर, एंड यहाँ पे है वर्टिब्रल जो combined है. So anterior spinal artery is one only, and this is basilar. A young man is brought to the casualty following a blunt injury to the chest. His BP is found to be 80 by 60. Jugular venous pressure बहुत ज़्यादा है. Auscultation reveals low heart sound and air entry on both sides is normal. Which of the following changes is likely to be seen in his JVP tracing? So here I think low heart sound, auscultation reveals low heart sound. So it is a tamponade. Uh, yeah. So tamponade in cardiac tamponade and pericarditis. So if it is tamponade, it is paid tax. So X. So prominent X and absent Y. A new resident doctor administers anesthetic in case of brain tumor surgery. A rise in ICP is seen. Which of the following anesthetic might be implicated? I mean, midazolam, ketamine, propofol, and etomidate. So this, so we know only the answer is ketamine. This is easy. 50-year-old chronic smoker presenting with hoarseness of voice was found to have an ulcerative proliferative growth on both vocal cords that appeared fixed. CT scan reveals its extension into the thyroid cartilage without any neck node involvement. PET CT is unremarkable. What is the management of the patient according to its TNM staging? Total laryngectomy followed by radiotherapy, concurrent chemoradiotherapy, transoral microsurgery, and अरे बाय मिस्टेक हो गया बट ओके ओपन पार्शियल laryngectomy with chemotherapy. So the answer is total laryngectomy followed by radiotherapy. So just remember कि if you are getting which is going into the thyroid cartilage, that is a T4A. तो उसमें we have to do total laryngectomy with radiotherapy. कहाँ कहाँ पे total laryngectomy करते हैं? T3, T4, all of them we are doing it. Invasion of thyroid, cricoid. So we'll just see it is contraindicated in patients with distant metastasis. तो एक बार देख लेते हैं what is the TNM staging. तो उसमें भी there are two types of no there is one staging पर AJCC का. T1 is if it is limited to the vocal cord but mobility is normal. Okay, so T1A is one vocal cord, T1B is two vocal cord, but just vocal cord, but normal mobility is one. T2 is when the mobility is also it extends to supraglottis and or subglottis. So ऊपर या नीचे गया है अभी, but again the vocal cord mobility is also over here also is normal only. In T2 is also normal. T3 is when it is limited to the larynx with vocal cord fixation or it invades the paraglottic space and or minor thyroid cartilage erosion. T4A is it invades the thyroid cartilage, invades the tissue beyond the larynx, and T4B is it is going to the prevertebral space in cases of carotid artery or it invades the mediastinal structures. So just remember, okay, it is going to be that. So T1 is just vocal cord and no mobility problem. T2 is now it is going thoda upar niche with no motility problem. Oh sorry, mobility problem. T3 is now it is going and having a mobility problem. फिक्स हो गया है या तो पैराग्लॉटिक स्पेस मेट इज गॉन और थोड़ा थायराइड माइनर थायराइड कार्टिलेज इन्वेजन इज देयर इरोजन नॉट इन्वेजन इरोजन इज देयर. And T4, now 4 is very like, oh, I have invaded the thyroid cartilage, invaded the tissue beyond the larynx. And T4B is it going to the prevertebral space or encasing the carotid artery, or it is invading the mediastinum. Now, Meek syndrome was suspected in a patient with right-sided pleural effusion, ascites, and ovarian tumor, which are the following statements is false. Can be caused by ovarian fibroma. Tumor would be immobile with an irregular surface. Pleural effusion is common on the right side. Ascites hydrothorax resolve after the resection of tumor. We have to find out what is the wrong statement. So I just did elimination process and I got it right. It is caused by fibroma. It does resolve after resection of tumor. Pleural effusion है right side पे common. Bus irregular and surf immobility are features of malignant tumors, but MEEC is a syndrome of benign ovarian mass. Which of the following is not topically used? Sulfonamide, sulfacetamide, sulfasalazine, mafenide, and silver sulfadiazine. Sulfasalazine is not used. We are using it in like IBD and everything. So that is the answer. Mr. Kumar, a 60-year-old male, had pain in the eye and a visual disturbance since 2 days after undergoing cataract surgery. What is the probable diagnosis? And see, this is a picture that they have given us. So basically, uveitis, retained lens matter, toxic anterior segment, endophthalmitis, and uveitis. So the answer to obviously hypopyon you're seeing. So it is endophthalmitis. I got this by mistake wrong. I don't know what I was thinking, but it is endophthalmitis. Okay, the image shows a picture of inflammation and hypopyon एंड इसको एंडोफ्थाल्माइटिस हुआ बेसिकली पेन है कंजंक्टिवल लिड इंजेक्शन स्वेलिंग डिक्रीज इन विजन हाइपोपियन भी है उसको द इंट्राविट्रियल इंजेक्शन ऑफ एंटीबायोटिक्स has become a primary problem. Whereas toxic anterior segment syndrome is characterized by diffuse limb to limbus corneal edema, and anterior segment inflammation. So, how do you differentiate? So, this is what they have this specifically for me only they have given. TAS or endophthalmitis को कैसे differentiate करते हैं? Vitreous inflammation is rare, no pain, little pain unless IOP is very high, a fixed dilated pupil, extremely high IOP, therapeutic response to topical steroids is clearly present in TAS. So just remember, okay, the vitreous, no pain. That is the one thing which over here they have said that he has pain. So that's how you can, differentiate it. A patient presented with abdominal pain imaging revealed a mass in the small intestine and a lesion in the liver. A diagnosis of CKIT positive GIST with liver mets was made. On further evaluation, what is the drug of choice? So we know that the drug of choice is imatinib only because that's how it is. But if imatinib resistance is there, then you can use other things like sorafenib, and all. Sunitinib also you can use. Sorry, but now over here they're saying that the FDA approved repretinib tablets, a new kinase inhibitor, is a fourth line treatment of advanced GIST. It is indicated in patients previously treated with three or more kinase inhibitor therapies, including imatinib. So now the new drug has come. It is called as repretinib. Repretinib. What defines a telecanthus? A widened interpupillary distance, widened interorbital distance, widely separated medial orbital wall, and widened root of nose with normal interpupillary distance. So this is telecanthus is basically बहुत ज़्यादा. The root of nose is so big, but the interpupillary distance is same. Hypertelorism is when there is a wide bone separation of the orbits. So if both the orbits are only far away place, that is called as hypertelorism. If the epicanthus मतलब एक थोड़ा vertical fold ऐसा कुछ तो आ गया, and that extends from the upper lower lids towards the medial canthi, and they may give rise to pseudo esotropia. So telecanthus we know now. Which tricyclic antidepressant has a additional dopaminergic receptor antagonist action? Clomipramine, doxypine, imipramine, and amoxicillin. So the answer is amoxicillin. Amoxicillin has tricyclic antidepressant having an additional dopaminergic antagonism, and बस और तो कुछ है नहीं इसमें जानने जैसा, but just remember कि it has. Then after that, next question is imaging modality shown below is a combination of which of the following: B mode image, pulsed Doppler acquisition. Then there is M mode imaging, waveform analysis, A mode imaging, power Doppler acquisition, and M mode with B mode imaging. So I know it is definitely going to be M mode और waveform कर रहे हैं ना.